My name is Garangake Garandor, and I am the founder of Kony Children Care. Kony was created in 2010 as a non-profit organization. I am 15 years old. I am from a little state in South Sudan, living in Buffalo, New York. I currently go to Canisius High School as a freshman. When I grow up, I want to be a doctor. I created Kony to save the lives of children in South Sudan. In the Dinka language, there is nothing more important than the expression Kony. Kony means to save a life. Kony envisions becoming a healthcare leader and providing intensive transitional care and living support for children with complex medical conditions and their families. Supporters and I believe that nothing is impossible. Therefore, Kony will be a life-saving center where the impossible becomes possible. The heart of Kony Children Care's mission and vision is to save children who have health problems, educate families on health issues, care and raise the children, promote well-being of children in rural areas through health care provisions. Kony will distinguish itself by its high quality and safe patient care and building a health care for all children in South Sudan. We look forward to building our first clinic project in Riamawe village in the Will State, South Sudan by 2013, following other programs to be constructed in 2014. We hope we will be able to build a clinic not only in Riamawe but also in other rural areas in South Sudan. You can make a difference in the lives of children in South Sudan by considering donating, providing services, or even volunteering and going on a trip with us to South Sudan. Please visit our website at www.kony.org and find opportunities to help. Thank you and God bless you.
Hi, my name is Luke Francis Akui. I am from South Sudan, Will State. I am currently a freshman at Buffalo Academy of Science Charter School. When I grow up, I want to be a doctor, a psychiatrist, and if possible, a lawyer. HIV and AIDS is one of the most dangerous diseases affecting people all around the world. However, South Sudan is one of the poorest African countries that needs HIV/AIDS, education, prevention controls, and treatments to those who are affected. Kony Children Care is to help fight HIV and AIDS for South Sudan.
My name is Atim Degnidu. I am 12 years old and go to Catholic Academy of West Buffalo in Buffalo, New York. I am from Arab State in South Sudan. In my country, people die from curable diseases. Today, I'm mainly here to talk about one of them, malaria. Malaria is a disease that is curable here in the U.S., but not in South Sudan. It attacks your blood cells, and if uncured, it may lead to death. It is caused by mosquitoes and related insects. If this was to happen in your country, wouldn't you want help? So join and help Kony Children Care build a clinic to treat malaria and other curable diseases.
My name is Athena Deng from Arab State in South Sudan. I'm 13 years old and attend the Catholic Academy of West Buffalo. When I grow up, I would like to become a kindergarten teacher. With 2,054 maternal deaths per 100,000 live births, South Sudan has the highest death rate in the world. On top of that, women have a 1 in 7 chance of dying during childbirth. About 25% of babies die within their first 5 years of life. Now you can see that lives of both mother and children in this new country are greatly in danger. Here in America, we are blessed with having healthcare opportunities, but in my country, it is not the same case. That is why I'm supporting Kony's goal and vision. We want to change such dangerous health conditions affecting children and women in South Sudan. From young to old, I ask you to support us in meeting our goals. One of the goals of Kony's is to build clinics and healthcare facilities. They will provide health needs and educate families about pre- and post-childbirth. Please join our campaign or simply donate today so that Kony's Child Care will be able to provide such needed health care in the Republic of South Sudan. Thank you.
Hello, today I'm here to tell you about Kony, but before I begin, I'll tell you about myself. I am Dordor. I'm currently 12 years old and attend the Catholic Academy of West Buffalo. When I graduate college, I wish to become a 7th grade history teacher. Kony is a nonprofit organization that wishes to change the healthcare of South Sudan. One of the many diseases we wish to change is tuberculosis. Tuberculosis is a disease caused by germs that spread from person to person through the air or by drinking dirty water. Tuberculosis usually affects the lung, but can also affect other parts of the body, such as the brain, the kidneys, or the spine. In most cases, tuberculosis is treatable. However, people with tuberculosis can die if they do not receive proper treatment. Tuberculosis is a major cause of mortality and morbidity in South Sudan. The World Health Organization reported that an estimated 18,500 people develop tuberculosis, and that 5,300 people die of tuberculosis annually in Southern Sudan. The high rise of tuberculosis in Southern Sudan has been rapidly growing and needs a quick response. Kony Children Care Vision in Southern Sudan is to eradicate such dangerous diseases.
Hi, my name is Akicham Chombarialwo. I live in Buffalo, New York. I am from Lake State, Tribeca County in South Sudan. I am in the 7th grade and I attend a school called St. Monica's College. When I get older, I wish to become a lawyer, doctor, or a psychiatrist. According to the World Health Organization, malnutrition in South Sudan indicates that children are suffering from malnutrition is disturbing. Severe mortality rate affecting children under 5 years old is reported. Child health is poor, with a high percentage of mortality, particularly diarrhea, combined with low measles and other diseases. It is unacceptable to let children die of diseases that can be prevented. We need children of South Sudan to have a better life. This is what Kony Children Care wants to do in South Sudan. But Kony cannot do this without your support. Please consider on how you can support us today. We want to be able to build clinics in South Sudan. Thank you.
Hello, my name is Mom Deng, and I am a 15-year-old sophomore at City Honors School. Kony is a non-profit organization who wants to change a country. This country is South Sudan. I am from South Sudan, and our country has suffered greatly and is still suffering now. Every day, thousands of people die from simple curable things that we as Americans take for granted. In the US, not many people die from malaria or having to drink unclean water to survive. In Southern Sudan, 1 in 7 people die from curable diseases such as malaria. Most children die within their first 5 years of life. Our duty and goal as Kony is to lessen and perhaps even stop what is happening in South Sudan. We will educate parents and children about how to take care of children while in the womb and in their early years of life. We want not to only be providers of medical care, but teachers of what it is to be healthy. Some people in our country don't even know how HIV is transmitted. We will build a clinic. We will stop deaths that can easily be avoidable through medical treatment. We want to help people reach their goals without having the overhanging thought that their next illness could be the end of their life and their goals. With your financial help, we can build a clinic in Southern Sudan and eventually go on to build many clinics. With your help or donation, Kony can change the lives of many people. Thank you for listening.
We are children from South Sudan living in Buffalo, New York, and America. We are supporters of Kony Children Care. Are you ready to help? You can do this by making donations to Kony Children Care, by joining Kids Network, by sponsoring Kony Children Care project, or by making partnership with Kony Children Care. Thank you for making the right decision to save children's lives through healthcare in South Sudan. Please visit our website at www.kony.org, and may God bless you for your support. Thank you again.